Hello and welcome to Secure Insights, podcast from Axis Communications, where we explore real-world insights from subject matter experts to learn how technology is shaping a smarter and safer world. My name is Steve Burdet. I'm the manager of the Solutions Management here in the Americas, and I'm joined today by two amazing guests who I'll introduce in just a moment. But before I do, I want to remind everyone that this podcast will be posted regularly to YouTube and all major podcast sites. So make sure you're subscribed, and if you watch it on YouTube, press the bell button to be notified when new episodes drop. Today, we will discuss the use of audio systems within healthcare, how the market and user preferences are evolving, and the opportunity it presents, where we're headed. To discuss the topic, we've invited two guests. We have Chris Wildfoerster, Program Manager for Audio at Axis, and Chris brings 3 decades of experience in audio and control industries, building channels, driving strategic partnerships, and developing go-to-market strategies in the security, commercial, and professional AV markets. Welcome to the show, Chris.
Thanks. Nice to be here.
We're also pleased to welcome Paul Baratta, Segment Development Manager for Healthcare at Axis. Paul has also over 3 decades of experience building market share in the healthcare space, and he has served as a chief of police for Beth Israel Deaconess Medical Center, as well as having spent 26 years in local and college campus law enforcement. Welcome, Paul.
Hi, Steve. Thank you.
To begin, we're hearing a lot more about smart hospitals and connected healthcare facilities. What does that term actually mean to you, and where does audio fit into the ecosystem?
That's a good question, Steve. And I think where we have been in the past is still reactive. A lot of people have video that's in the ceiling, watching things that are happening. They have to go back and they have to look. Where we have come today and where technology has come is that it's become the eyes and ears and also the voice to not only security, but to patient care. And it's also, we've brought in environmental sensors now so we can monitor the air quality. We can monitor if somebody is vaping in a bathroom. We can monitor different levels of CO2 and things like that. So we've gone from being a reactive kind of space to a proactive and really understanding the environment of the hospital. And that's a smart hospital.
Well, that's excellent points, Paul. And, at the end of the day, when you think about these separate systems, when they were analog, everything was a separate system, right? Kind of operating in their own different silos. Now you bring audio in there and it basically brings that whole ecosystem together. Because what's the first method, the most popular method of communications is audio, is via voice. Second is the flashers or strobes, right? Different color strobes for different activities. And the third is going to be scrolling text.
So historically, audio, security, and communications have operated as separate systems. Why are healthcare organizations moving towards a more unified approach?
Well, healthcare is like a lot of other different facilities, right? As we said before, you had these different systems operating in silos. And audio is important from a security perspective because it really stops an event from either happening or escalating. That's the key, right? When somebody can see something on a camera and have a notification triggered in a speaker saying, hey, stop, a security is on the way, or something like that, they can basically prevent that event from escalating or even happening, right? It deters the event. So that's where audio really comes in. And you had these separate systems before, as we said earlier, all these analog systems were separate, but now you've got audio basically as part of that complete ecosystem, telling people what's going on and where to go and what to do.
Yep. And I like to use an example that we had at one of the hospitals. They had an emergency exit that everybody was going through daily, and they were tripping the alarm. And what was happening is security constantly had to respond to that door. So they were taking away from what they really should be doing, but going to that door by adding a camera and a speaker there. That we added analytics so that when somebody came halfway down the stairs, there was an announcement, an automatic announcement. It actually stopped the people from going through that door. And so it actually, instead of responding to that door 6 or 7 times in a shift, it completely stopped it. And it was an easy fix. It was using one of our cameras that has a speaker that's built in. And it was a very easy fix. And it was it added to the way that they do their daily job. It gave them something that they didn't have to respond to that door all the time.
Yeah, so what you're saying is you created a good synergy by putting these all together. They could work together to deter and or reduce the nuisance alarm.
Yeah, it becomes the eyes, the ears, and the voice. Systems used to be so separate that it wasn't until probably into the 2000s, probably like 2010, in that era there, that people started to use video management systems and start to combine these things so that it became a useful tool. In the past, audio was with the telecom group, and elevator controls were with the facilities group. The security had the video that they'd have to go back and look at for hours if there was an event to find it. And today, we've become more of a streamlined process, and the business efficiency of that has really changed.
So now when you have that security officer, right, it frees up their time. So how long would it take to get to that door, right, to secure the door, then go back and then do the paperwork, right, to basically say, confirm that the door was secure and it wasn't a false alarm. So now you're freeing up that security officer's time to do other things that are more important. And you're saving money in the long run.
Yeah, absolutely. And, with the shortage that there is out there right now of staffing, and it continues, it's hard to find people to work in hospitals today. They're inundated. Calls for service to a security group or public safety group in a hospital is amazing. The amount of responses that they make. That I remember when I first got to my hospital, I was in amazement at the number of calls for service that we were doing on a monthly basis. Compared to when I was in a municipal department, it was almost twice. And so, and then you have workplace violence, right? And you're responding to patients that are violent. And so you have 3 or 4 security officers that have to respond to that event. And you don't want to take somebody away to go to a door.
Yeah. And so this actually opens up to maybe the next question, but what makes healthcare audio environments uniquely challenging compared to other sectors like retail or transportation?
Well, when you're putting an audio system together for healthcare, we're talking about public address, right? A mass notification. We're not talking about nurse call system, right? So that's a whole different world. So some of the challenges are, it's important that you have clarity in your messages, right? And access, we put DSP, digital signal processing, in our speakers, so the voice comes through clear and audible. Second thing is you want to make sure when you're making announcements, you're 6 to 10 dB above the ambient noise. Now, that ambient noise can obviously fluctuate greatly. If in an emergency room, right, there's something going on, you want to have something that's basically going to automatically adjust to that, which Access will have in the near future, called ambient noise sensing. Thirdly, you want to make sure you have the proper coverage, right, as far as where the speaker's located. You don't want to have hotspots, right? If you have a hotspot, people are probably going to disconnect that speaker versus an area where you should have a speaker and you can't hear the announcements. So like any other facility, it's about proper coverage, it's about clarity in the signal, and it's about also reliability, right? It's on the network.
And one of the things that's really interesting in healthcare is the amount of speakers that there are that, daily you don't think about it, but there's hundreds, if not thousands of speakers throughout the hospital. You have them in the ceiling. So you have them for public address.
Mm-hmm.
You have them in patient rooms now. You have them in operating rooms and operating theaters. You have them in the ICUs, the PACUs, and places like that. So if you really, as a security director, audio probably isn't in your thinking about it. But if you walked around your hospital and you started to really look and see how many speakers there are throughout the hospital, I think you'd be amazed. It's hundreds.
So that's a good point, Paul, because typically what we're seeing is that, for every camera, in a security application, for every camera sold, it's about a 15% attachment rate for speakers. That's audio for security. But when you start looking at audio for public address or audio for mass communications or mass notification, that number is typically 5 to 7 to 10 times for every camera. So now for every camera that you're selling in a project, there's another 10 speakers, 5 to 10 speakers that go with that. To your point, Paul. And now we're just talking about the internal facility, right? Now think about the external, the perimeter. Right? Now you're talking about the parking garages. You're talking about parking lots and things like that.
Yeah. And where we started was with the horns, right? So where we really started in audio was with the horns. And today, you'll see a lot of access horns on the trailers that are holding multiple cameras, and there's a horn there. But also you see them, especially in areas where there's storms, tornadoes, and hurricanes and things like that in the parking lots. So in the past, you really weren't communicating to anybody that was out in the parking lot. It was more internal within the hospital itself. But now you have the ability to send notifications out into the parking areas to say, hey, listen, there's a thunderstorm coming. There's a bad lightning storm or whatever, and send that notification out to the parking lot and let people know out there that either shelter in place or get inside. And so we didn't have that ability 15, 20 years ago. But with the way that we've developed the audio horns, the way that our whole system is developed, the IP, and it's really, you just need a drop now, right? So you have power over Ethernet, plug it in, and you're working. In the past, if you wanted to put some type of speaker or a horn out in a parking lot, you had to bring out power, you had to bring out cable, you had to bring out copper, all these different things. And then you had to try to tie it into this analog system, transformers and everything else. Today, where we are in audio and healthcare, it's a single plug. Plug it in, it works.
Yeah, and they've got network in a lot of places. So you're unpacking a lot of interesting and complex things. When you're talking to a hospital, maybe the executives for the first time, and they're interested about audio, what are the first things you're helping them consider assessing when there's so many that they could start with?
Well, for me, it's all about total cost of ownership. How easy it is to install Access audio along with our video. There's something that I am always very proud of, is that when I hear IT directors talk about Access Communications, almost every time one of the things they talk about is our ease of install. And that's something that they see as such a benefit to them. And then the other thing is that we have now environmental speakers built in. So we have the ability to not only monitor the air quality, but actually put announcements over the speaker. And with the room of the future, as we build in the room of the future, is more about having two-way communication, monitoring telemetry, making it easier for nurses to respond, making it more proactive for clinicians, telesitting, telehealth, and all those things. Is we've developed cameras like this that have not only have built-in acoustic sensors and have built-in speakers in the device itself.
You know, as a follow-up to your answer, Paul, is total cost of ownership. Are we talking to an executive? Because let's face it, when you look at network speakers, they're more expensive than analog speakers. So we offset that cost, right? Because everything we have is basically is one of our salient speakers here. But this is a built-in system unto itself, right? So basically PoE in, and you have a system, right?
Yep.
You don't have to have that central amplifier, 2-conductor wire, just Cat 6, PoE power to the speaker, and you're done with that. It's one of our salient speakers. So from a total cost of ownership, we can justify that. If you can trigger a specific announcement to prevent or deter an event from happening, such as the unlocked door, right, a propped open door, or maybe there's aggression in the emergency room. Because you think about violence in the hospital, it's more prevalent really than really any other facility, I think, right?
It's number one. Violence in healthcare is number one still. And it always is something that is in the forefront of our minds at Access Communications as we start to develop solutions. So we have partners like Single Wire and Lynx that have panic alarms, and they do mass notification and things like that. But we now use audio in those. And so not only are we collecting data visually, but we're sending notices to people with our strobes as well. So one of the things that we've done with strobes, which is really interesting, is especially the strobe speakers, is if there's an emergency in a certain area, we can turn the strobes red in that area and announce not to go to that area. And we can turn others green to send people through to evacuate. We have some hospitals that have problems in the parking lots. We're able to put those strobes near the exit doors, turn them red and send an announcement that to wait, do not go outside until the event is clear. So it's more about thinking about take audio and combine it with visual, right? And actually have announcements as well and make it a safer environment because workplace violence, again, is number one. So how can we make it a safer environment with technology?
So you guys have opened up a lot of different things. And before we dive into the other topics, I want to ask, if a healthcare executive only has the budget to fix one audio pain point this year, where should they start to get the biggest impact?
So I'm thinking the best place to start would probably be in the emergency waiting room area because high emotion, right? There's a lot of stuff going on in that specific area. And the first thing I would do is make sure that you're playing some nice relaxing music, right? Background music. And also have the ability, right, to make announcements in that area and have some analytics and maybe some cameras in case there's aggression or in case there's any kind of bullying or any fights there. So it's the SOC.
Yeah, that's like a perfect answer because it's the great unknown. So in a medical center, when you have a trauma emergency department, or you just have any emergency department, you don't know really who's coming through the door. So I always talk about it as being the great unknown. So you have somebody that comes in the door, you don't know if they're carrying a weapon, you don't know if they're a drug addict, you don't know if they're just drug seeking, which happens is people just come in seeking drugs and they're looking for, they're saying, oh, I have a toothache, I need drugs, right? So you have those people, and then you have gangs coming in, gang members coming in, people that have been victims of violence and things like that. So it's the great unknown. So if I was going to put in an audio system, whenever you're looking at anything like you want to say, okay, where should we start? I would say the emergency department is probably the first place. And that's why, because once they come out of the emergency department, you kind of know who you have. So when they move to the floor, you can flag them and say, okay, this person is violent. You also have a lot of what is termed forensic patients, and those are patients that are under arrest or they're in the correctional system that come through the emergency department. And so that's just another level that you have coming through.
So let's talk a little bit about improving that patient or visitor experience. It seems like that's a really important part of the healthcare space. Most people think about audio during emergencies, and we've had some good examples of that so far, but what role does it play in the everyday patient experience?
Well, in the everyday patient experience, at the end of the day, it's keeping everybody informed, right? You can look at it from two perspectives. Number one is entertainment, right? You want to have some music going through there, whether you can choose your own music in the room or whether it's a general area, right? And you have general relaxing type music. Number two, it's important to have with these announcements, again, as I mentioned earlier, you want to make sure the announcements are easily heard, right? They're understandable, the clarity is high, and the volume's correct, right? So if somebody's in a hospital, they hear a message, they don't want to have to kind of strain to say, well, geez, was that about me or what's going on, right? Audio really sets the mood, right? It sets the tone of a specific environment. Every room, I think you can have separate TV or volume controls, right?
Yep.
And I'm not sure if you can actually if you don't monitor the audio in each patient room.
You can.
Per se, you can today.
Yep.
Well, there you go. I should have, prepared
Problem
better.
solved.
So, and actually you have the, whatever that is.
Yep.
Q93.
Q9307. Yeah. LV.
So that,
which was actually designed by our end customer. So our end customers came to us and they said, we need a really good speaker.
Mm-hmm.
We need really good acoustic sensors. We need a good way to be able to observe the room. And what can you build? And so I believe the speaker on that is 89 decibel. And there's 4 acoustic sensors. How do we improve not only patient care, but how do we help supplement staff? And then the other part of it is when you have clear notifications, then people know like what to do or what not to do. It's important.
Yeah, why don't we unpack that a little bit? Tell me more about the use of clear communication to impact patients, visitors, staff. I mean, how can that be a useful tool?
well, again, as you mentioned earlier, it's important that whether it's a visitor or a patient or staff, that they hear the message and they understand the messages, right? That's critical. And again, I mentioned the two things. Number one was DB level, and number two was the digital signal processing. And when you're looking at general announcements, you're looking at just a PA system, maybe to locate somebody, Dr. XYZ, right? Please come to the emergency room, whatever it might be. But then you have mass notification. That's a whole different story, right? Where basically you have an event taking place within a certain area of the hospital, and you basically want to notify everybody within that area what to do, where to go, and people maybe outside that area what to do and where not to go, right? Because the first reaction is if there's a specific event taking place at a facility, hospital, otherwise, the first thing everybody wants to do is run out of the building. But that's not necessarily the case. For every event has different activities that you should take, right? And it's not always get out of the building.
Yeah. And it also could help you where, a lot of times the security officers are responding to an event. They're going into an event. It's funny that you talked about going out, right? So everybody else is going out, they're going in. So sometimes they're like the blue uniform canaries going into these events. And what if it's actually a hazmat event and they shouldn't be going in there? And so audio can be used to make sure that people don't go into that area.
Along with a different color strobe, right? So maybe you have the yellow strobe, maybe hazard.
Yep.
Right, saying don't go.
Yep. Well, they use the strobes in hospitals for notification as well. Code blue, the strobes go blue. Code pink, which is an infant abduction or attempt, they go pink. Areas that you're able to enter without a problem, they go green. Maybe operating theaters. I know in one hospital we have it so that if the theater is being used, it's red, so that people know they just can't walk in because it's the middle of an operation. So there's a lot of use for audio in hospitals. And I think I go back to what I said earlier. Your normal day, you don't think about it. But if you really walk around your hospital and you take a look, you'll be shocked at how many different audio devices are in a hospital.
So let's dive into that. Because if they are going to be shocked, that likely means that there's some common mistakes healthcare facilities make when it comes to their announcements, their audio systems, their public communication. So what are some of the common mistakes they're making and maybe ways they could improve on those?
I think, number one is the design, right? They need to have somebody come in and actually help them design the system correct, right? Whether that's a consultant or whether it's an integrator, right, who's familiar with audio. They want to make sure that they follow the quote unquote the rules of the road, right? It's physics. You're not going to change physics, right? You're going to get X amount of coverage with X amount of dB mounting your speakers in these specific areas. And the secret really to putting together a good system, whether it's a healthcare facility or other facility, is to make sure that you have even coverage. You don't want to have hot spots. You don't want to have low spots, right? You want to basically keep it even throughout the floor. So as you're walking along the corridor, as you're going from room to room, the audio level stays the same. That's the key.
Yep. And there's design tools that are available, and those are helpful as well.
Right.
And the biggest thing with audio in healthcare is it's just not for emergencies. It can be for other things. You could have waiting rooms where you have music. You can also use analytics like gunshot analytics.
Well, glass break, right? Screaming, shouting, I think, are a couple of other examples.
Yeah, that you can add to these devices so that, again, it's all about being more proactive and having it be a tool that's going to help.
So we've been talking a lot about emergency and communications in that. So let's dive there. In an emergency, communication is everything. How does the integration of audio solutions reduce the time it takes to get the right people to the right location?
That's a very good question. And seconds save lives, right? Seconds matter in the specific events. So when you think about a public address system is basically going to be used. They can be used for emergency announcements, if you will. But at the end of the day, they're really used for more informational announcements, to find people, to play music, that kind of thing. When you talk about a specific emergency, quote unquote, emergency events, then you're going to want to think about a mass notification type system. So that's where you think about a single wire alertus or Lynx or Intrada, right? Those kind of type systems. And what they do is, in addition to working with a public address system, right, they'll also notify the facilities and local parents, it may be in the case of a school, and local first responders of what's going on and what type of event it is. Now, how do they do that? They do send out SMS messaging, right? They'll do emails, they do 911 calls, really notifying everybody of what's going on and what the type of event is. And that's key, because there's different reactions to different events. If you've got a seismic event, it's one action. You've got a weather event, it's another. If you have an active threat, that's another, right? You're in a medical emergency, that's another type of event. So there's a lot of different types of events that have different reactions. And those mass notification platforms, they'll work in unison with the public address system. We complement those systems, but they'll also they'll work with digital signage. They'll work with access control. They'll do lockdowns, right, depending again on the event. They'll work with the AEDs. They'll do elevators, things like that, right? So they really have control over the whole facility versus where a public address system really focuses on just the audio.
You know, the security operations center are usually manned with one or two people. They have the video coming in, the audio coming in, they have the alarms coming in, they're answering phone calls. Patient belongings go there. It's the only 24/7 operation in a hospital. So at 3:00 in the morning, a lot of times I used to say to my people, you're the president of the hospital. And if something happens, the decision that you make at that desk could be devastating to the brand, right? Or it could be devastating to the entire hospital. And so by adding things like audio and automatic announcements and using the video management system to be able to send out notifications or things like that, it actually helps with the overall operation of the hospital. And so if you really think about those security operations centers, there's usually one or two people that are in there, and plus the walk-in people that are coming in the door. So you have a lot of activity going on in those areas. Sometimes you want to segregate those areas by saying, okay, somebody that's working on the video and the alarms and stuff, we're going to put them in a back room. But 3:00 in the morning with staffing, sometimes you only have one person. And so it's just a way to make things more efficient and safer for everybody by using the things like audio and video together.
To follow up on what you were saying, Paul, about that one security officer,
Yep.
At 3:00 in the morning, if that one security officer can basically see someone cross a perimeter line, let's say, right outside the facility, they shouldn't be there, he can actually either A, have a recorded message play, B, do a live call out telling that person, hey, you in the green hoodie, right? You're not supposed to be there, leave. Or number 3 is you can have a two-way conversation with that person because maybe they just wandered into an area, right, and weren't familiar that was a secure area or they shouldn't be there.
Yeah.
So again, it's a force. Audio is really a force multiplier in that marketplace.
Yeah,
I'm hearing a lot of automation in that as well, to blending these systems together, make it that much easier when you have a limited resource of people to be able to do those deterrents without someone getting an alarm, pressing the button, having to talk to them. They can have all this automated so that it matters. They get the things that say someone's already moved past those deterrents and they don't care. And now we've got
it all works into those 5 layers of security, right? That you have 5 different layers as you get closer to what is defined in healthcare as a sensitive area. So if you have something like a hazmat area, you have different levels of security before they get to there. So you can use audio as a deterrent. Or if somebody comes to a door and it's an unmanned door, right, to have an intercom there so that they can talk to the security center at 3:00 in the morning and say, hey, listen, I'm trying to find the emergency department. And there's a lot of areas in hospitals where you have things like nuclear materials and things like that you have to secure. And there's lab spaces and there's animal labs and things like that are all within those in a medical facility. And so there are 5 layers of security. By having audio as part of that layer, it helps with keeping places safer and maybe stopping people from getting into that sensitive area.
And don't forget audio adds content, right? When you look at video, it's more one dimensional.
Yeah.
Right. There's the video. But it's interesting when you see the video and you see the event taking place. But now you add audio to that video. And now it really it completes the story, right? It really sets the whole stage. Was it really a fight taking place or was it 2 friends just screwing around? Or, who started the altercation? Was it this person or that person? And how was it started? So Audio really adds that different dimension. I like to say we go from a one-dimensional type solution really to a three-dimensional or multi-dimensional.
We're exploring how like code alerts, lockdowns, evacuations are really critical things. What are the common failure points in a healthcare PA system during a real event? Things people should be mindful of that when it all goes sideways, this is where you're seeing the problems or failures and maybe an area they should focus on improving or fixing.
The one I think most important point is if there's a specific event, and we talked about mass notification, right? So let's say there's a system in place. So regardless of the event, whatever it is, like I said, whether it's a threat on campus, whether it's seismic activity, weather activity, medical emergency, whatever it might be, you want to make sure that you have an analytic in there that's going to basically play a recorded message of what that event is, what to do, where to go. That's number one. Because the last thing you want is someone going on a radio or picking up the phone saying, "Oh, there's an emergency. What's going on? What's going on?" Because they're going to be panicking, right? The adrenaline's going to be running. When you have that recorded message, it's done in a measured tone, easily understand, and really clearly enunciates where to go and what to do. I think that's the number one thing you really want to keep in mind in a specific emergency.
Maybe a failure point would be that they don't have an automated system, so you have a stressed person who's making more people stressed, which amplifies the situation.
Or that person may give wrong directions, right? Who knows? That person may not be familiar with like you said, the 5 layers of protection and things like that. What do you see as the?
Well, I think one thing that if you're going to put in an audio system, you talked about this earlier, is that you have full coverage. And a lot of times in hospitals, you have dead areas, what we call dead areas for the radios, for the two-way radios. And maybe it's because of shielding or whatever that's in the area. And so you want to make sure that you have full coverage and that, again, that the messages are clear. A lot of times pre-recorded messages are the best. And that you're giving good direction to everybody. Make it a general kind of thing, not have it be specific to, the security department or the facilities department, have it be a general announcement.
So a few times today you've mentioned how physical aggression is one of the highest threats in this environment. How can a well-designed audio system help with intervention and maybe reduce some of these workplace violence incidents that occur?
Well, first of all, with acoustic sensors, you can use analytics to determine different screaming and yelling and things like that. If you get that kind of analytic alarm, I'll call it an alarm, then you have the video to take a look and actually make sure that it's a celebration. And so, but it sends a notice to the security center, operations center, that there's something happening. Take a look at this, right? So it'll come up on the screen. And also that you can send messages back to the staff. Let's say that there's something happening in the area and you want to ask, by using the microphone that you'd have at the desk and say, is everything okay there? Or, whatever you want to communicate to them. But having that two-way communication is really powerful. It's eyes, ears, and voice.
If you could take a before and after snapshot of a facility that went from a legacy audio system to a connected system, what would be the most striking difference?
I know the most striking difference is really behind the scenes in the equipment room, right? Because typically with an analog system, you rack them and stack them. You've got a rack of gear here. You got your equalizers. You have multiple amplifiers, DSPs, equalizers, all that kind of stuff, right? That basically requires a dedicated room typically, and you have to cool that room and run electricity to it. So with network-based systems, right, it's basically all PoE. So it goes in the data center, and it's already cooled, right, because you've already got all your servers in there already for the hospital. And it's PoE out to the speakers, and it's pretty much done. Whereas with an analog system, you've got to connect all those different components in that rack, right? Points of failure. You then basically have to run dedicated wire, right? 2-conductor wire out to every one of the speakers throughout the facility. Dedicated wire, which has to be shielded if it's going in the ceiling, right? To avoid any kind of interference or hum. And whereas with a network-based system, Cat5 to the speaker, Cat 5 or above, right? To the speaker, runs data, runs power, and you're done. It's a lot cleaner installation. So you're going to save a lot of money, right? Even though the speaker may be more from a hardware perspective, from a piece-by-piece perspective versus an analog system, when you look at the labor savings on the back end, it pays for itself.
And if I'm also hearing you throughout this, you're going to get so much more out of a system like that because the analog comes with so many other limitations and challenges that you're not utilizing it to the extent that you could with new networks and capabilities.
Yeah, analog devices on intelligent sensors. Today, our devices that are out there that are being powered by the Ethernet, power over Ethernet, and they're intelligent sensors. There's the analytics are sitting at the edge, and they're getting better and better. Again, I go back to always saying that there's an expectation you have to set that nothing is perfect. Nothing's going to replace an actual human being, but you're helping them respond to an event safer.
And just to follow up on that, analog systems have their place. I sold analog systems for a long time. But when you think about it, analog speaker, what does it do? What do all speakers do? They move air. That's all it is, right? You have different frequencies that reach your ear at different times. They're moving air, right? Basically, the driver is vibrating, and that's what the sound is you hear. But when you think about it, when you look at network type speakers, they not only move air, right? They're on the network. They have analytics built in. They may have IOs built in. They may have microphones built in for two-way communication. So DSP. So there's a lot more than a network speaker does than an analog speaker because we do more than move air. Right? It does more than move air, I should say.
So for the decision makers that are listening today, audio can sometimes feel like an invisible investment. How do these solutions actually improve the bottom line or patient outcomes?
Oh, there are certain studies out there. We're talking about TCO, basically, right? The total cost of ownership. And there are studies out there and numbers out there. We can basically show how a network system really helps you save money and really pays for itself, right? It may be more on a CapEx perspective. It might be more on the front end, but you want to look at it more from an OpEx, right? So once you get beyond that first couple of years paying for the system, after that, it pays for itself, right? But with save time and save time, the initial installation costs, right? Saving money on that. But I think at the end of the day, when you're looking at it from a facility owner, facilities management perspective, it really comes down to OpEx and how you're going to save money as time goes on. And don't forget, right, where we are today is not where this stuff is going to be tomorrow, right? So it's just going to get smarter, it's going to get more efficient, and really help a facility owner save more money as it goes.
Yeah, and we're in the place now. It's all about patient experience. So at one time for a hospital, it was about like almost like a hotel, right? It was like you have 850 beds and you wanted 850 patients, right? But it's changed now to be all about patient experience, and so when you talk about wanting to have a better experience by adding audio into the equation, it's actually helping with patient experience. And so a lot of the CFOs and everybody now, they're looking at how do we improve patient experience.
How does the audio layer of a hospital security ecosystem look different than today?
I would say that where we are today, think about technology. We're now in the next industrial revolution. We're in the AI, right? Artificial intelligence, right? I think that you're going to start to see more artificial intelligence brought into not only our sensors that are video sensors, but into our audio sensors. And I talk about this a lot when I have the opportunity to speak, is that artificial intelligence is going to change the way that we do business every day. And we're seeing it at certain levels now. I think in 5 years from now, it's going to be incredible. And what we did in going back in time, right? We had a time when there were DVR, and you basically changed the tapes. And a lot of the people that have been in healthcare for a long time will remember you had 31 days. So you had 31 tapes and you changed the tape. And then we went to NVRs, and NVRs were analog devices. They were hardwired. And then we went to VMS. Today we're going to cloud. Well, it's the same with artificial intelligence. The last industrial revolution, in my opinion, was computers. We're now into the next level, which is artificial intelligence. And we're going to see artificial intelligence on all of these devices.
Yeah, particularly if you're talking about it, we're moving to being more proactive within these systems, having automated, stopping, going down that door.
It's just not
opening
going to
up.
be safety either.
Yeah.
It's going to be about you pull up in your vehicle, the gate is going to open. It's going to tell you what space to go to in the garage. When you get in the garage, there's going to be an announcement that's going to come over to tell you where. It's going to identify you so it knows that it's Steve. Oh, Steve, you're going to see Dr. whatever. The system itself will say, Steve, go to the third floor. You're going to get to the third floor, and the system is going to say, please wait in the waiting room, and they'll come out to get you. So it's going to be more automated with artificial intelligence. So 5 years from now, I think that all of these sensors are going to be even more intelligent.
5 years from now. I don't think it's going to take 5 years. I think the way AI is progressing right now, we're at the infant stage, right? This is the entry level, if you will. We haven't even seen the hockey stick growth, which is probably going to take place probably in the next 1 to 2 years. So you're 100% right where you're going to see the speakers, network speakers become much more intelligent, right? More systems, sensors, and devices. But the one thing you're not going to change is physics. So a speaker is going to cover so many areas. You've got different frequency responses, different dB levels, things like that. That's physics. You can't change that. But you can change the information that you gather from the device and basically have that device on the network feed into other systems at the facility. So I think you're going to see much more of that. And again, if this, then that, right? If this happens, if I sense this, then I do, then these actions take place. So, and that's kind of happening today, right? It's already happening, but I think it's just going to get more sophisticated and more streamlined as we go forward. I don't think it's going to take 5 years.
Yeah, well said. Well, looking forward to the next 5 years. And thank you guys for joining us today. And that wraps up our conversation. I want to thank all of our listeners and viewers. If this topic interested you, make sure to subscribe to the Axis Communications America's YouTube channel. And press that bell button so you can be notified when new episodes come out. And if you'd like to learn more about anything that was discussed today or get in touch with your local Axis rep, either click on the link in the description below or visit our website at axis.com. Paul, Chris, thank you again for joining us. I really appreciated the conversation. And to our audience, remember, a smarter, safer world doesn't build itself. It takes ideas, partnerships, and the courage to keep innovating. Thank you for joining our conversation today. This has been another episode of Secure Insights.